Hi, this is Dr. Ruscio, and let's discuss the question, are most functional medicine tests snake oil? If you've been struggling with a health problem and perhaps frustrated by the limitations of conventional medicine, it can be alluring when along comes functional medicine, which promises to treat the root cause. And even perhaps more alluring when a test is offered up as something that can find that root cause. Why am I having chronic brain fog? Why am I having chronic fatigue or insomnia or loose bowels or abdominal pain and bloating? But what this actually seems to translate to is excessive testing, expense, and really this paradigm of treating the numbers rather than treating the patients. Now, it's also our belief that functional medicine doctors and clinicians have the best intentions, but they seem to have been misled into thinking that testing offers more utility than it does. And what's unfortunate here is all of the incentives seem to be pointed in the wrong direction. Labs are incentivized, of course, to educate and market about their tests. And doctors oftentimes will proclaim their progressive model of testing can really help patients uncover the root cause of their disease. And if patients are watching or listening to videos or podcasts or reading blogs, they can get sucked into this. So, the labs and the doctors and even the patients all seem to have this incentivization toward more testing. And unfortunately, this has led to the current state of affairs, which we term the treating the numbers model. And I want to try to outline for you how fallacious this is so we can really start turning the tide toward the paradigm we use and advocate for, which is that of treating the person. Okay, so let's detail what you as a patient or a doctor need to be aware of and why treating the numbers doesn't work and why we must treat the person instead. There are two operating principles I want to develop in order to convey this. One, the scientific literature overwhelmingly informs how to treat people and not how to treat tests. So treat people, not numbers. And two, many labs are inaccurate, even fraudulent, and should not be used. So let's develop point one here. We put together this table to help showcase, again, the overwhelming majority of scientific research guides clinicians how to apply therapies to patients and their symptoms or their clustering of symptoms, sometimes known as various syndromes. And there has been very little scientific research regarding how can we use a given lab value to personalize and to guide treatment. Let's look at probiotics for IBS. Many patients have the mistaken belief, and even doctors, that a stool test will inform how we apply probiotics. Yet when you look at the scientific body of evidence, only one study in existence has done a stool test and used that stool test to then give a probiotic. Whereas there are 2,649 studies in existence that help guide a clinician in terms of how do they apply probiotics to individuals with this cluster of symptoms known as IBS: bloating, distension, abdominal pain, and altered bowel function, whether that be constipation, diarrhea, or an oscillation in between the two. How about mood? There are 0 studies in existence that inform how to use testing, let's say a stool test, to then treat someone's depression or anxiety. Yet there have been 19 clinical trials that inform how clinicians can use probiotics to support depression or anxiety. How about adrenal support? This might be the most surprising because it's kind of a common practice in the field to do a baseline adrenal test and then give various adrenal supports based upon the tests. There are 2 studies in existence, one from my friend and colleague Dan Kalish and one case study, whereas there are 75 to 85, depending on what parameters you use, that inform how do we use various adrenal supports to help people with fatigue, with insomnia, with caffeine dependence. Okay, so again, the trend line here is overwhelmingly toward looking at a person and their symptoms, understanding them, and applying the therapies to them, not to a lab value. And what about food allergy avoidance? There are 8 studies that have guided someone's diet based upon food allergy testing, whereas there are 80 for guiding the diet via IBS symptoms and 742 for digestive maladies altogether. So again, the overwhelming majority of the scientific research that a clinician can go to learn how to be a better clinician informs how to treat people and the symptoms that they're suffering with rather than a lab value. Even something like rifaximin, which is an antibiotic for small intestinal bacterial overgrowth, amongst other conditions, even in this scenario, there is still more evidence guiding how to treat the person rather than how to treat the lab value. So even a prescription antibiotic has more evidence for how to treat the person and their symptoms than it does the lab values. Although this would be one case where the evidence seems to be fairly evenly mixed. So hopefully this table helps you to see that your clinician has much more to pull from in terms of groups of patients with symptoms similar to yours, and they are given either placebo or a treatment. There is much more information on looking at the person and their symptoms and their history than there is a lab value. So again, one reason why I say that the scientific literature overwhelmingly informs how to treat people and not how to treat tests. Now, in addition to this, the second point, some labs have been discredited or even had litigation brought against them. So our principle 2, many labs are inaccurate, even fraudulent, and should not be used. And I've discussed this before, but it's worth repeating. Ubiome, a very popular stool test, literally used dog poop, dog feces, to help establish what the normative ranges were for humans. And this is likely in part why they were subject to an FBI investigation, later went bankrupt. And as more of this investigation rolled on, insiders from the company said the science was flawed from the start. And again, this was a test that I had warned against for years, but sadly, patients would routinely come in with Ubiome results in hand asking, what do we do with this? And my response was always, this test has not been validated. It's not something that we should be using. And this is not the only example. As I've also discussed before, a neurotransmitter testing company pled guilty to falsifying lab ranges in order to sell more supplements through their sister company. Inaccurate and unnecessary labs are distracting from the root cause rather than clarifying, and they really limit your care to treating the numbers instead of treating you as an entire person. So in summary, those 2 principles, the scientific literature overwhelmingly informs how to treat people and not how to treat tests, and many labs are inaccurate, even fraudulent, and should not be used. In the next video, I'll explain our model in direct comparison to the standard model so you can easily compare and contrast and decide for yourself what model you think is best for you. I hope that this video has been insightful, because if we can save patients from squandering hundreds or even thousands of dollars on lab work, then that is a huge win. And if we can help prevent patients from wanting to ask their clinician, what about this test? What about the other test? And stop wasting that time on having your provider use your valuable time together to explain some of the fraudulence of these labs, then that's a huge win, because now you and your provider can go to work on better understanding you, your symptoms, your history, and then personalizing care to you, such as we've just outlined is what the majority of the science helps us to do. Okay, this is Dr. Ruscio. I hope that helps. And again, the next video, we'll do a direct side-by-side comparison of our model to more of the standard model.